So in review, this is the axial cut of the brain at the level near the foramen of Monroe. So for the gross anatomy, again, this is the anterior horn of the lateral ventricle, both right and the left. We have the septum pellucidum, the caudate nucleus, the head of the caudate, and then the lentiform nucleus, which composed of putamen and then the globus pallidus. The claustrum, the thin gray matter in between the putamen and then the insula. So this is the internal capsule, which carries the motor signals from the primary cortex down to our extremities. The extreme capsule, the internal capsule, external capsule. The external capsule in between the putamen and the claustrum. Here, the thin gray matter in between the putamen and the insula. And also the extreme capsule. This is the thalamus, both right and the left, which makes up the medial, which makes up the lateral wall of the third ventricle. This is also the intercommissural fiber known as the corpus callosum, the anterior, the posterior portion of the corpus callosum. As what we have discussed earlier, the basal ganglia is also associated with other nuclei. The substantia nigra, subthalamic nucleus, and other brainstem nuclei. So this is the substantia nigra, located in the anterior portion of the peduncle. This is the pigmented area. This pigmentation is secondarily to neuromelanin. So for a clearer view, this is the sagittal section of the brain. This is the midbrain, and then the pontine area. Here in the anterior portion of the midbrain, or mesencephalon, here the peduncles are the two substantia nigra. This releases dopaminergic interaction to the basal ganglia, which will be explained by the pathophysiology of Parkinson's disease. So for the other nuclei associated with basal ganglia, we have the subthalamic nucleus here. So here we have the coronal section of the left hemisphere. This is the superior portion. The inferior, or the basal regions of the brain, the insula, the sylvian fissure, and also the MCA branches. So in this section, we can clearly see the basal ganglion nuclei. Here, associated with the wall of the lateral ventricle, this is the body of the lateral ventricle, this is the caudate nucleus, this is the body of the caudate nucleus. This is the internal capsule, which carries the signals from the primary motor cortex down to our extremities. The lentiform nucleus, composed of putamen, the darker area, and the globus pallidus. Here, a very, very thin gray matter is the claustrum. So the other nuclei associated with the function of basal ganglia, as we can see here, is the subthalamic nucleus. Here. So disorders or lesions of the subthalamic nucleus can also cause movement disorders. So as what we have discussed earlier, the basal ganglia is composed of several nuclei with intricate connections to different portions of our brain. So for the entry point or the input area of the basal ganglia, we have the caudate nucleus and also the putamen. This is the main sites for receiving inputs to the basal ganglia. So it receives inputs from the cortex, cerebral cortex, particularly in the sensorimotor, primary sensorimotor area. So the track from the cortex to the input area is known as the corticostriatal tract. So in general, the striatum, which is composed of the caudate and the putamen, is the input area. So other areas that contributes to the afferent signals to the putamen are the thalamostriatal area, the pallidostriatal area, and also the brainstem striatal fibers. So lastly, I forgot, one important afferent projection to the striatum or to the caudate and putamen is fibers from the substantia nigra or the nigrostriatal fibers or tract. These fibers are dopaminergic that controls and modifies the function of the basal ganglia. So here, again, we have the substantia nigra, the pigmented area in the cerebral peduncles. So to clearly view it and to also construct a 3D image, we have here the sagittal view of the brain. Here is the midbrain or the mesencephalon. Located anterior to that, or the anterior portion of the midbrain near the peduncles, is the substantia nigra. So this is it is one of the most important afferent projections to the basal ganglia. So degeneration of this area leads to decreased dopamine input towards the basal ganglia, leading to Parkinsonism. So recap. The input area of the basal ganglia is the striatum, which is composed of the putamen and the lentiform nucleus. So, aside from afferent projections, it has also efferent projections to other areas of the basal ganglia and also to the nuclei associated with basal ganglia. So, one of the most important projections is the striatopalidal fibers. So these fibers are GABAergic, which is inhibitory. So the main function of the striatum towards the globus pallidus is usually inhibitory. So, in recap again, the afferent projections to the striatum from the cortical, thalamus, substantia nigra are mostly glutaminergic except for the dopamine, predominant dopamine afferent from the substantia nigra. So, also, the striatum has connections to the substantia nigra and the subthalamic nucleus. So, in recap, these connections are GABAergic, gamma-aminobutyric acid, which is an inhibitory neurotransmitter. So, striatum to globus pallidus is inhibitory. So, for the pallidal portion, which is the main output area of the basal ganglia, it has afferent projections from the striatum, as what I have discussed a while ago. And for its efferent projection, it projects to the thalamic area, the thalamic nuclei, particularly the ventro-anterior and also the ventrolateral nucleus of the thalamus. Also, it projects to the subthalamus via the fasciculus lenticularis, subthalamus, here, it tracks fasciculus lenticularis, and also the palidotegmental fibers from the globus pallidus to the tegmentum of the midbrain, and also the palidothalamic fibers which passes underneath the subthalamic nucleus. So the most important of these projections are the ansa lenticularis again, and also the fasciculus lenticularis. These projections control the activity of the ventro-anterior and also the ventrolateral nucleus of the thalamus. So the main neurotransmitter produced by the globus pallidus is still GABA, GABAergic neurons, which is inhibitory. So meaning it inhibits the stimulation of the thalamus towards the cortex. So in general, the output of the basal ganglia is usually inhibitory.